everyone. This is a presentation on the evidence for barrier analysis and doer-non-doer studies. I originally made this presentation back in July 2nd of 2012. My name is Tom Davis, and I'm currently the Global Sector Lead for Health and Nutrition for World Vision International. Back in 2012, when I produced this, I was a senior specialist for social behavior change for the TOPS project and an employee of Food for the Hungry. First of all, I wanted to share with you a bit about some of the findings of the core group Social and Behavior Change Working Group. They basically have done what they're calling powerful to change studies, where they looked at organizations that have had the best results in terms of changing behavior, like increasing hand washing with soap or exclusive breastfeeding, in order to identify the most effective practices that seem to help with making behavior change happen. So what they did with that is they took data from the data set that we have, looking at project final indicators, comparing them to baseline, and looked at projects that, say, would focus on nutrition and breastfeeding. And from those, take the best performing ones in terms of indicator gap closure for exclusive breastfeeding and compare those projects that had the best results to those projects that closed less of the gap, had less change from baseline to final. And then sort of compared and said, what are the projects that are having the best results there? What are they doing that maybe the others in that group that doesn't perform as well are not doing? They found two keys that seem to make a difference. One is they were using the right coverage strategy. So they're reaching all of the right people through peer educators and systematic home visitation, which usually involve peer education and cascading, and teaching a volunteer who then reaches out to a set of neighbors. We're not going to talk about that today, but the second one instead. The other thing they found they were doing was using formative research to choose the best messages and activities for behavior change. Things like positive deviant studies, barrier analysis, doer-non-doer studies. And we'll be talking about barrier analysis studies now. So what is barrier analysis? It's a rapid assessment tool used to identify the most important behavioral determinants from the health belief and theory of reason action models. And it's associated with a particular behavior in ag and RAM, health, nutrition, city planning, and other sectors. So those behavioral determinants of those behaviors can come from a range of different sectors that we work in. It's used to develop more effective behavior change communication messages and activities by many organizations around the world. And it's also part of the new Designing for Behavior Change multi-sectoral training. A key feature of this is it compares doers and non-doers, people practicing the behavior and people not practicing it. Doer-non-doer analysis is very similar to barrier analysis, but it focuses on a more limited set of behavioral determinants. I developed this back in 1990 and then subsequently modified it based on AED's Behave framework and doer-non-doer analysis. And I have a link there if you want to listen to a more full presentation on this methodology. Here are some of the determinants that we focus on with barrier analysis, like perceived self-efficacy, perceived social norms, access, perceived action efficacy. These are the things that are explained in the full presentation, but some of the determinants we have found that are more important to look at as you're doing your formative research. Let me tell you a bit about a project that used barrier analysis that I was involved with, and sort of what are the results that we saw of using this. This was a USAID Child Survival and Health Grants program in Mozambique that Food for the Hungry did. It had a health and nutrition design similar to MyApps, Title II MyApps that are being done in FH Burundi, FHDRC, and South Sudan, and it ran from 2005 to 2010. It was active in 8 of 13 districts of Sofala province, Mozambique. We had about 220,000 beneficiaries in the program. And the interventions mostly focus on nutrition, but also diarrhea and integrated with community IMCI. So there are the beneficiary numbers there. So the problem was that the baseline KPC found that there are only 17% of infants under 6 months of age who were exclusively breastfed in the last 24 hours. We wanted to look at how we can improve that, and we decided to use barrier analysis of exclusive breastfeeding to help decide what messages and methods and activities we should use. So, the purpose of the study that we did was to help communities and project staff to discover behavioral determinants of exclusive breastfeeding through interviews with mothers of infants in 5 districts of Sofala province, Mozambique. We did a one-day training of the paid project staff and how to do barrier analysis. And then we had a sample of 90 mothers of children 0 to 11 months, 45 who were or had exclusively breastfed, and 45 mothers who were not or had not exclusively breastfed. Okay, so here's an example of the findings. We found a statistically significant difference between people when we asked them who would approve of your exclusively breastfeeding, or who approves, depending on if they're a doer or non-doer. 58% of the doers, the blue bars, said friends, aunts, brothers, sisters, or parents. Only 24% of the non-doers said that, those who were not exclusively breastfeeding. And on the other hand, 51% of the non-doers said, I don't know anyone who would approve of it, and only 20% of the doers said that. So care groups include all pregnant women and women with small children in a community. Messages are delivered to the household and are received by all household members. In this way, you can change social norms. So the research informed who we needed to target, that we needed to go beyond just these women and make sure that other people in the household and community heard the same message. And the Community Development Committee members also heard this messaging from the promoters. Next, what are the advantages to exclusive breastfeeding? We asked them that. The doers were more likely than the non-doers to say it's less expensive. And the non-doers were more likely to say there is no advantage of all. So that helped us to know that in terms of an important message to get out there is that people could save money by exclusively breastfeeding. Also, child grows well. That had a p-value of 0.06, so just barely not significant. But we also promoted that message since it's a good one as well. So that was emphasized during discussion about the advantages of breastfeeding. Then we asked about what things make it easier to exclusively breastfeed. And what the doer said was the mother taking a balanced diet. So we could use that in a number of ways. One is encouraging breastfeeding mothers to try to eat an extra balanced meal every day. And also reminding them that even if they can't do this, the child will get enough nutrition from the breast milk. But it will help them to do it if they're able to take that extra meal a day. And this is what we saw in terms of results. It was 17% in February of 2006. We began exclusive breastfeeding promotion in April of 2006 and used these results of the barrier analysis studies. And by May 2006, it had jumped to 67%. By September 2007, 75%. And by December 7, 95%. It dropped off somewhat after that as we moved on to different topics in the entire area. But I think we finished that above 80%. It was quite high at final as well. And we also saw a concomitant decrease in underweight, which was about 26.8% in February 2006. And by September of 2008, it had dropped to 15.6%, which was a statistically significant change. Let me mention also another example of using barrier analysis in agriculture and NRM. This is evidence from CRS's Segamaya program in 2 different provinces of Guatemala, San Marcos and Baja Verapaz, which was culturally very similar, the two. And in June 2009, staff in one of the 2 areas, San Marcos, received the Designing for Behavior Change training, and they did barrier analysis and developed a DBC strategy and indicators for ag and NRM. And we'll talk a bit more about that in a second. The staff planned to replicate the training in Baja Verapaz, in that area, but they got too busy responding to an emergency in a third area, and so they never ended up doing the DBC training, the barrier analysis, or any of that work in Baja Verapaz. So it helps us to have a comparison area to look at sort of what sort of changes did you see between the two areas. So they had the same program and monitoring system in both areas. So Baja Verapaz then could serve as a comparison area to examine results of the DBC training and strategy. What they decided to focus on with their barrier analysis study were key soil conservation practices, planting live barriers along the edges of planting terraces was identified as a practice with the lowest adoption rate, despite the fact that it only required local labor and free local plant materials. So they would plant these live barriers along the planting terraces to help hold the soil in. They didn't understand why people were doing it. It seemed like it's something they could do with their existing time and resources. So they didn't understand why, and that's one reason they used barrier analysis. So in the San Marcos area, they did the DBC workshop and did a shorter version of the barrier analysis survey, the doer non-doer survey, but it still includes a lot of the same questions. In the comparison area, they determined their strategy and messaging using their past experiences in the area. They didn't do any additional formative research. They made the decisions the way a lot of projects make decisions, having the professional staff sitting around tables saying, what have we seen? What do we think the problem is? And coming up with a new strategy. And what they found was that most farmers, this is from the barrier analysis results, most farmers, the doers and the non-doers, both fully understood the benefits of the practice. But the doers were more likely to work together with other people, with other farmers, to plant the barriers. And the doers also said they liked the practice because they didn't lose plantings due to drought, where the non-doers were less likely to say that. So that's a key advantage they could take into account in deciding on their messaging and their strategies. In San Marcos, the strategy focused on organizing farmers to work together on each other's lands during the off-season to plant the barriers. So that's one way they use the BA results. Also, farmers groups brainstormed to develop strategies to prevent loss of plants due to drought. Since that appeared to be something, if you didn't lose your plants due to drought, you're happy you would do it. If you did lose it, you might say, I don't want to do that anymore. I spent a lot of time and they all died. So they needed to help everyone learn how to avoid loss of plants due to drought. And here are the results. This is what they saw in terms of results. The number of hectares planted with live barriers. The red line is Baja Verapaz, where they did not apply social and behavioral change tools. They did not use barrier analysis, doer non-doer analysis. They didn't do the DBC training. And the blue line is in San Marcos, where they did apply the tools. And you can see they had a pretty remarkable increase in the number of hectares that were used, planted with those live barriers. Here's some of what they heard when they asked staff about using these social behavior change tools. They had asked, overall, was the DBC training and development of a BC strategy helpful? And for example, one person said, yes, it's completely changed our way of thinking. We no longer think in terms of we and them. Rather, we're a team with the participants in finding solutions to barriers. Another person said, it never occurred to us before the training to figure out the barriers or what makes people want to change. We wasted so much time and energy repeating the benefits over and over, then feeling frustrated because no one adopted the new practices. And when asked what was the most useful part of the DBC training, they said going to the fields to do the doer, non-doer, these smaller barrier analysis surveys. Until we saw those responses, we thought we knew our target farmers and what they think. It was incredibly revealing. And lastly, they said, understanding the wide range of factors and determinants that influence adoption of practices. So these are some of the things that seem to matter to the participants as well and why they thought it was useful to use barrier analysis.